What is arthroscopy used for? Arthroscopy is a surgery where the surgery is carried out through keyhole incision. Through one of the incision, the camera is introduced into the knee joint or a hip joint or ankle joint or shoulder joint. Through arthroscopy, various surgeries can be carried out which are difficult to carry out by open route. In knee joint, arthroscopically, a meniscus surgery can be done where meniscectomy, that is removal of torn part of the meniscus, can be done. The second surgery is repair or reconstruction of ligaments. Anterior cruciate ligament, posterior cruciate ligament and other ligaments can be repaired or reconstructed through arthroscopic surgery. The third is if there is osteochondral defect anywhere in the knee joint, it can be cleared, drilled with the arthroscopic surgery. Arthroscopic surgery can be done for even during stem cell therapy. So arthroscopy surgery of a knee joint or any other joint is very easy surgery to do. Second thing, it can be performed for complex problems inside the joint which cannot be accessed by open surgery. Number 3, arthroscopic surgery will be done through a very small keyhole incision, so recovery from the surgery is very fast.